Now I'd like to recognize the representative from Virginia, Mr. Beyer, for 5 minutes for questioning.
Mr. Chairman, thank you very much, and thank you all for coming here today. I'm really glad we're having a chance to talk about supporting opportunity for individuals with disabilities. 45 years ago, I was on the founding board of the Independence Center in Arlington, Virginia, where I learned, yet again, that the most important thing for anyone with a disability is the desire to be independent, to be as independent as possible. My next youngest sister was born with an intellectual disability, and she worked in the family business with me side by side for 27 years. She was the heart and soul, the charm of the business. But very few intellectual or people with disabilities have the benefit of a family that has a family business that can take them in. And earlier this year, I joined with my friend, Mr. Smucker, to introduce the Enable Act to better support individuals with disabilities. It strengthens the ABLE accounts. It allows them to save and invest without jeopardizing their eligibility for federal programs like SSI. It allows higher contribution limits, a saver's credit, and among other provisions to better support so they can live independently. And I hope to work with Chairman Estes and Ranking Member Larson to get this bill actually moving and pass. I'd also like to express concerns, as my friend Mr. Gomez did, about the current attacks that we're seeing. He had the poster up with Treasury Secretary Bessent talking about a backdoor to privatizing. You've heard some of the other pretty scary language about it being a Ponzi scheme. Ms. Groninger, the Republican Study Committee, which most of my Republican colleagues serve on, released a 2025 budget plan full of cuts to Social Security that would directly hurt their own constituents and Americans across the country, and this specifically is gutting disability protections. Since this hearing is about supporting individuals with disabilities, how, from your perspective, how might this negatively impact those with disabilities?
Well, I think that you made a really important point when you talked about the fact that there are a lot of people who don't have the kind of family support that your sister did. There are people who are depending on Congress to help them get the supports that they need, find out how they can work if they so choose, use the resources that they have available. And when that's not happening, you see people who are falling into deeper poverty. For people, for example, who are trying to work and don't have ABLE accounts, the asset limit as it stands is very low. So I think in addition to ABLE accounts, for example, we can do other things such as raising the asset limit so that people don't even have to go through that really. It's a difficult process if you don't have people supporting you. There are ways that we can actually provide services to people with disabilities and seniors. There's legislation that we can pass that would actually support people with disabilities and seniors, and I think that that's something that we should be doing.
Thank you very much. And Mr. Groninger, I'm really afraid that the science denialism we're seeing, the anti-vaccination campaigns, are going to hit people with disabilities particularly hard. You know, we talk about herd immunity, but when there's no herd immunity and you can't get vaccinated because of your medical condition, it's a great, great danger. Many Americans with disabilities are at risk of more severe health consequences or even death if they're infected with a vaccine-preventable disease. And in addition, falling ill due to preventable disease means missing work. And the great concern with RFK Jr., the whole MAHA agenda, is that it can be anything but healthy for people with disabilities. I love your perspective.
So vaccines have been proven to be effective in helping people to maintain their health. And I think that part of what people with disabilities and seniors need is to be able to access vaccinations and be able to get the health care that they need. And so I think what we are worried about and things that we've seen, for example, with the COVID-19 pandemic, older adults and people with disabilities were most at risk. And so if we're not giving people access to vaccines and access to appropriate health care, we're going to see a lot of people who are sick and dying and hospitalized, and it's preventable.
You're making the astonishing case that the lack of vaccinations is going to put more people on disabilities, that we're actually making the problem worse. Well, thank you very much. I appreciate this, and Mr. Chairman, I yield back.